What is a concussion?
Well, a concussion is often called a mild traumatic brain injury. It's where the brain sustains some sort of injury or damage. It may be very slight or subtle. It could be more severe. The ones that we think about are sports-related concussions, where the brain gets some sort of injury that interferes with its ability to function. And it may have many presentations or symptoms that the patient presents with.
How bad trauma does it take?
It's different for everyone. A lot of it involves the mechanism of injury. Certainly, is it a direct blow? Is it a shearing or spinning blow? How much of the brain has been disrupted with that injury? So I think that the impact is different for everyone in terms of eliciting symptoms and concerns.
So what are the symptoms? Let's take a young high school boy who has a head contact in sports, any type of sports, and he gets his bell rung. What are the symptoms that we look for with concussion?
Obviously, there's multiple symptoms. Probably the most common thing that I hear reported is headaches.
What kind of headache?
Everybody describes it a little bit different. Some people describe it as a pressure or just a pressure sensation in their head or a pounding, throbbing headache. Some people describe a migrainous type headache with nausea and visual disturbances. So everybody's a little bit different in how they describe that headache, but it's a pretty common theme in concussion.
Headache, what else?
Dizziness, fogginess, just not kind of feeling right. Some people lose memory or recollection of events prior to the injury. Those are all common findings.
So they have retrograde amnesia,
Correct.
Amnesia before the injury. Is that a worse sign?
There's some studies that suggest that if you have retrograde amnesia, that your recovery may be a little more prolonged than someone who doesn't display that symptom. So it's certainly something that we pay close attention to and consider that when we're evaluating patients.
Why do you always come and say, how many fingers do I have, and are your pupils dilated?
Yeah.
What are we looking for on that?
Yeah, the concussions, what we're looking for is making sure they don't have some sort of structural injury to the brain. You know, one of the things that you don't want to miss in a head injury is a bleed in the brain. You know, did they have enough injury to damage a blood vessel? And if there's a bleeding in the brain, you may see unequal pupils. You may see inability to track lights with the eyes. Those sort of physical exam findings that would suggest that patient needs more urgent evaluation.
By urgent, you mean what?
An emergency room visit, you know,
Okay.
some
Right
sort of
away.
imaging study. Correct.
There may be a bleed into the brain.
Correct.